Good Monday evening to you all. We begin tonight again with the threat of a massive nurses' strike that, if contracts aren't settled, could come by this weekend, 6 days from this night. So hopefully it's all hands on deck to come to an agreement this week. Tonight, Alina says it worked today for a deal with the nurses and plans to keep at it tomorrow. The group that represents Children's Minnesota, Methodist, North Memorial, and M Health Fairview said their negotiations went late into the night last night and they picked up again this morning. That group says they're making progress and that mediators are actually helping. The nurses union hasn't given us an update today. Of course, there's a lot at stake for both sides as they try to avoid this massive strike, but there's even more to lose for patients. Those who study health outcomes say the talks happening right now could be the difference between life or death. That may sound extreme, but it's based on some of the most extensive research we already have. Kent?
Yeah, Jana, and if this sounds familiar, that's because it is. Back in September, the man you're about to hear from was interviewed on our show and quoted elsewhere about his research into the risks that come with these nurses' strikes. And while we made it through that period, he says there is much more at stake right now. If you're wondering whether nurses' strikes have potentially deadly consequences for patients, a deep dive into 20 years of evidence from strikes in New York State provides a sobering answer.
We found that nurses going on strike led to during the period they were on strike, led to a death rate increase of almost 20%.
It has now been more than 10 years since Jonathan Gruber, the Ford professor of economics at MIT, wrapped up that landmark study.
How do you think the pandemic has changed what you found?
I think it's heightened the issue. Kent, we have a massive undersupply of nurses. Many nurses have opted out of returning, either becoming traveling nurses or moving on to new careers. And there's just a desperate shortage, which, if anything, I think would make our results a little more worrisome in the context of a strike today.
And he says a strike next week would also be more worrisome than the 3-day strike in September for several reasons.
For a shorter strike, people can defer. We saw a lot of people deferring their care. In a longer strike, that gets harder to do. You're certainly at a dangerous time of year with winter coming in Minneapolis and people getting hurt shoveling snow or other winter activities. So I think the longer it's going to be, the more dangerous it is for the health of Minnesotans.
A lot of us are asking as new parents.
It would also come just weeks after hospital administrators and doctors held a rare news conference to raise awareness about bed availability and emergency department wait times due to respiratory illnesses. And despite announcements last week that hospitals will bring in traveling nurses to fill the void, Gruber says history is not on their side.
We didn't find that made things a whole lot better. The notion that we can just fill these spots with replacements is not true. And once again, particularly worrisome given the shortage of replacements that are even out there today. In the period I was studying, there were replacements available.
And if you think that bolsters the case for either nurses or hospitals right now, he says you're missing the point.
We are not opining on whether the nurses in Minnesota are compensated too highly or too little or the other working conditions. All we're saying is that it's very painful for patients to resolve those differences through a strike, and that other means of resolving those differences would be a lot less damaging to the health of Minnesotans.
He says it would also help both nurses and hospitals address the issue driving all of this.
We need to be doing whatever we can to encourage workers to come into the sector, to encourage training so that workers already in the sector can get trained up to take the jobs that are going unfilled. And those are the things we need to worry about in the long run.
Now, with so much at stake for patients, Jonathan says it's surprising that our government rarely takes an active role in avoiding strikes. He says that sets us apart from the rest of the world. On that front, Jana, last week we reported, of course, that Governor Walz is engaged with both sides, but for now he says he's hopeful that the collective bargaining process will bring an agreement before the deadline. And right now it does appear that there is some progress in those meetings again.
Yeah, we should tell our viewers, we got information that we just shared at the top of the show. When we know they're actually still speaking to each other, that's a good sign that they're still negotiating till 2, 3, 4 in the morning.
That is a good sign, and that's something, frankly, that the governor is watching as well, because when those talks break down, when nobody's coming to the table, that's usually when our elected leaders get involved to try to get them in the same room.
All right, thanks, Kent, so much.